Hi, it's Dr. Noel Williams, May 23rd, 2020, COVID update. My practice is Optimal Health Associates in Oklahoma City. I'm an OBGYN. I was in the U.S. Public Health Service in, 87 for 4 or 5 months with a focus on infectious disease prevention in a hospital setting. So a lot of experience just in general with medicine and with had some formal training at the CDC and U.S. Public Health Service. So this has been a very, very interesting time to revisit those skills and those interests. So we're going to talk a lot about children today, the CDC guidelines, and why the alteration, and why I was so conservative in February, why I started doing these posts so conservative in March, so conservative in April, and why we're adjusting. And I have a nice journal article to share that will highlight this. So first, on Facebook.
Okay, go ahead.
On Facebook. I will put it on Facebook, but I will show you the article. So anyway, statistics, just about 6,000 cases in Oklahoma. We're going up about 100 a day right now, 90 to 100 a day, 311 or 12 deaths, unfortunately. United States, I think I have it right here, 1.65 million, almost 98,000 deaths. So unfortunately, we'll hit the 100,000 mark in the next 2 days, probably, or 3 days. And then worldwide, we're at 5.2, about 100,000 a day now, and about 340,000 deaths. And again, the death rates and who really died of COVID, who had COVID and died, and some of that stuff gets confusing. But ultimately, those are probably around the accurate numbers, as accurate as we can get. And there's no big scheme to make more COVID cases. And so it's just how it all falls out. So let's talk about kids. And I want to talk about kids because we're really in good shape with kids. And the whole point of the original shelter-in-place mitigation strategy was, one, to make sure our hospitals didn't get overwhelmed, because we were very, very, very concerned about that here, and that was because of initial data out of China. And two, if we could slow the onset of the disease, we would then also learn about the disease and figure out what to do that's appropriate. So if you kind of look at what's gone on, we realized ventilators may not always work as well. I got an article from Norman Imes, again, critical care doctor, talking about perhaps people aren't always recognizing ventilator-related injuries for ARDS patients with COVID. And that's, again, cultural knowledge too. I mean, medicine's changed a lot. We've lost a tremendous number of senior people who were extraordinarily gifted at critical care over the last 10 years because of all the Obamacare changes. And I'm not being political, it's reality. A ton of very seasoned physicians said, screw this, and they retired because it's too much of a hassle to practice sometimes when you get older with all the changes. It just is. So we lost cultural knowledge, and so some of the ventilator stuff and this ARDS stuff and acute respiratory distress, adult respiratory distress syndrome, it's a learning curve. So we've learned now more about ventilators. We've learned in terms of how to use them for COVID patients. We've learned that just an article out that everyone was under the impression that steroids were the exact opposite of what we should do. Well, it turns out, no, that's totally incorrect. We should have been giving steroids early and aggressively, it looks like. So again, it's learning, and you have to go through that process when you have a new disease entity. So let's talk about kids. So great article from one of the British medical journals, and I'll put it out tonight eventually, but there's a glare, but you can't really see it. Sorry, I'll get it out. But it's Children Are Not COVID-19 Super Spreaders. Time to Get Back to School, published May 5th. It's from Archives of Disease in Childhood, one of the British medical journals. And just keep in mind that the British medical journals have been very conservative about this entire process. They've been highly critical of, the British medical journal has been highly critical of Plaquenil, and so they are very conservative. And this article goes through what's going on with children. And the first thing that it talks about is children have a very low rate of actual positivity for infection. There's no documented super spreaders. They were the index case, meaning they were the one who brought it to the household less than 5% of the time or less. They may have gotten it out at the household, but they are not spreading it. There's an example in this article, and I would strongly encourage everyone to read this article, where one kid who was infected exposed more than 100 children closely over several days, and not one of them got infected because kids are just not getting infected, and they have a minuscule risk. The numbers of children who have actually gotten sick, virtually all the ones who've gone into the intensive care unit that are documented had significant comorbidities. 3 in one of the Chinese reports. 1 had intussusception, which is a life-threatening bowel event, and the other 2, 1 had, I believe, leukemia, and 1 had something else. So they were already acutely ill, and it kind of then falls into this thing with which people have said already about COVID, that some of the deaths, someone has leukemia and they have COVID and they die of leukemia, but it gets charted as COVID. Some of the children's stuff may actually really be that way because it's so rare. So the first thing is kids aren't getting it under 10 almost at all. They're not getting sick. And so the point for this journal article is kids can go back to school, teenagers can go back to school, early 20s can go back to school, okay? It's fine. It's fine. And all the hullabaloo about children needs to calm down. Schools can open. We can do this. It's doable. They're just not the risk group. Now, should there be some limitations? Sure. I mean, we want to make sure there's more soap and water around and hand sanitizer and maybe spread the desks out. Some of that stuff makes a lot of sense. But do we need to go wackadoodle? And so there's a meme going around, or not a meme, it's a summary of what the CDC guidelines were. And I read it too and thought, oh, this is crazy. But I actually have the CDC guidelines now. And the meme that's gone around about the masks for 2-year-olds and all of that stuff is an exaggeration. They make suggestions that are supposed to be collated with local public health officials. Now, have they done some things that I think are a little bit silly? Oh, probably. But it is the CDC after all, so we wouldn't expect some of the interim guidelines to be perfect, or maybe not unconservative, but this is what it says. Implement multiple social distancing strategies. Select strategies based on feasibility given the unique space and needs of the school. Not all strategies will be feasible for all schools. For example, limiting hall movement options can be particularly challenging in secondary schools. Yes, they're like locusts trying to be together, as they should be. They suggest, and these are strategies to consider, cancel field trips, assemblies, and other large gatherings. And that it's something to consider. It's not something you have to do as a school, especially if you're in a low-risk situation. If you're in Gotebo, Oklahoma, where there's very little cases, and why would you cancel stuff at the school? Cancel or modify classes where students are likely to be in very close contact. Well, again, it's a recommendation, but not one I think we necessarily have to completely follow, because physical education is very important. Choir, which they also list, is very important for those people. And there isn't any data showing case cohorts in children from doing that in the world literature. And that's what's important. Increase space between desks. Sure, that's reasonable, but really somewhat silly, because if one person coughs, the coronavirus goes 12 to 18 feet in like 20 seconds. But, social distancing guidelines, it's totally fine. Avoid mixing students in common areas. For example, allow students to eat lunch and breakfast in their classroom rather than mixing the cafeteria. That to me is completely silly. And again, but it's just a recommendation. You don't have to follow it because, again, the kids aren't getting sick. Stagger arrival and dismissal times, again, is just a suggestion. Reduce congestion in the health office. So yes, if there's sick people in the little health office at a school, the other kids shouldn't go in there. I think that's very reasonable. Limit non-essential visitors. This one, again, kind of silly. They said, volunteer readers, cafeteria support, the parent helpers to the teachers. Again, I don't think, again, it's a recommendation, but again, stupid. It's unless the virus. Now, this is with the caveat that there's not any virus around and things are like they are now. Limit cross-school transfer for special programs. So that means if you're having a Model UN assembly, let's say at Moore High School, and people from Edmond and wherever Putnam City are going to go, maybe you should do those virtually. That's not anything I think major, and I think that makes sense right now. Teach staff, students, and their families to maintain distance from each other in school. Again, just basic concepts. So I think most of their recommendations are pretty much conservative CDC recommendations that you can consider. I don't think they're anywhere near as draconian as was presented, so I wouldn't get all that fired up about them. We just have to hope the school administrators understand these are fairly low intensity guidelines, and the kids don't really need to do much of this, period, because they're not getting infected. And that's what I want everyone to realize. The 20-somethings, the early 20s, the college students, again, virtually no case clusters at all in the world literature. So school should resume normally. It should resume normally. There's some more recommendations for colleges I'll go over tomorrow, but again, they're a little bit too much of an emphasis on virtual classes and not face-to-face learning, which I think is important for students, and some things with the food, again, not sensible, because it's really turning out kids, A, don't get it, and B, they don't spread it all that often. And so we have to relax on this. We have to make that adjustment because we've learned. I mean, we have a nice medical journal article from a very conservative medical journal that's been highly critical of a lot of what I think reasonable other science. So they've even said, no, we got to relax on the children. So I think we can. And that gets back to masks and things like that. So what's really the purpose of a mask? The real purpose of a mask, if it's a surgical mask, is to prevent spread of disease from the surgeon to the patient while they're asleep, so there's not germs getting in wounds and things. So when you're wearing an N95 mask or a KN95 mask, those are going to be pretty blocking for you, but they're also going to be fairly blocking of letting germs out. And that's the primary purpose, I think, of wearing masks as we've started to accumulate knowledge. They are not going to be super protective for anyone in terms of getting sick. Now, an N95 mask worn totally appropriately can be, but that's hard to do over a course of a day. But those ones can be. But ultimately, the purpose of the masks is to limit droplet spread to others. So just everyone can be pretty chill about if you see someone without a mask, it's not the end of the world, okay? And so we just have to go with that. So as we start looking at everything now, we can shift because there's not as much disease events going on. Our testing has gone up. And so it's okay for us to start doing things. We can start going out. We can start going to restaurants. We can go shopping. We can interact outside. Again, I think it's okay to keep 6 feet away from people as you're talking to them, to be conservative. But if you're on your vitamins and you're on, because this is the other part, why are people getting sick? Because they're nutritionally depleted. And so you look at the diabetics, you look at hypertensives, you look at obese people, you look at people with sleep apnea, they're often nutritionally depleted. My partner, Cassie Smith, gave a rundown and a video on diabetes and its risks for COVID. Please refer to that because we have that listed, don't we?
It's on our Optimal
It's
Health
on
Facebook page.
the Optimal Health Facebook page, sorry.
You can post it on yours too.
Yeah, we'll post it on mine too. But she gives she's a wonderful endocrinologist, and so she gave a nice review of that. And I'll probably try to get her to do one on hypertension too. But the thing with hypertension is there's the angiotensin-converting enzyme receptors. And angiotensin-converting enzyme is an important enzyme that works in the kidney. And the ACE2 receptor, I believe, versus the ACE1 is where the COVID attaches. And so there may be some role for hypertensive patients and that receptor to be a little bit more able to be infected or to have a mass escalation of the inflammatory event. But again, that's what we're looking and seeing. So again, I'm just nutrition. If you're on a multivitamin, zinc, melatonin, and vitamin D, you're going to be in really great shape with this. And then the other final thing I'm going to go mention is it's okay for schools to be open for another reason. If the kids are getting it a little and they're not getting and they don't get sick, what does that generate? Herd immunity. We need 70% of us to get it to have herd immunity. So if kids get it without much effect at all, which is the rule of thumb, it's okay for them to get it. The Kawasaki disease, which they do talk about in this article, incidence is so low that these authors conclude, like they've always concluded about Kawasaki disease, it is not something that changes any parameter of the child recommendations at all. Zero. So the summary is children are safe. They really are very safe. Under 10, fantastic. Over 10, probably pretty much equally fantastic. Kids with serious diseases who have severe respiratory disease, they're acutely ill. Yeah, getting COVID at that time's bad. If you're get leukemia and you happen to, whether you're an adult or a kid, and you do happen to get COVID, it's probably the wrong time to get COVID. But that doesn't necessarily mean that you're going to die from COVID. And so we just have to keep it in perspective on this stuff. And that's why we have to relax a little bit and start leading more normal lives. So that's the summary tonight. I'll talk more about college kids tomorrow. I'll post these some of these journal articles later this evening. And that is all. And I did not talk about the drug that shall not be named. Good night.